This is Ruderman from Northwestern University in Chicago. I'm here at RWCS. I just gave a lecture on evidence-based medicine and osteoarthritis. I took a look at some of the published evidence for a lot of the treatments that are being used in osteoarthritis. First, looking at some of the sort of non-conventional treatments, the alternative treatments that patients are always asking for: acupuncture, cupping, different types of injection therapy. And the answer is that there's very little good evidence for most of those. Probably the best evidence exists for acupuncture with some modest benefit in terms of pain, and certainly it's quite safe. Some of the more troubling evidence is in the space looking at platelet-rich plasma or stem cell injections. The data for that is not great. There are a number of trials. The problem is that the preparations are non-standard. How they're given is non-standard, and it's really hard to draw any firm conclusions given that these are not covered by insurance and can be quite expensive and potentially have a huge placebo response because you're injecting something unknown into somebody's joint. I just can't recommend those at this point as part of the standard management of osteoarthritis. The last thing we looked at was tanezumab, a nerve growth inhibitor, a nerve growth factor antibody that's being developed for treatment of osteoarthritis. Quite a bit of data over the years. Some of the issues are complications of rapidly progressive osteoarthritis or neuropathies that have been seen with this antibody. It is effective, not clearly very much more effective than a non-steroidal anti-inflammatory. So the niche for these drugs may be in patients who are not ready for or can't tolerate a joint replacement and can't take a non-steroidal. These may offer an alternative approach to pain management when necessary.